So I'm really delighted to welcome everybody to Children's Health Queensland and Queensland Children's Hospital. I'm Julia Clark. I'm a paediatric infectious diseases physician here at Queensland Children's Hospital. We are got lots of people here and lots of people online, so we're trying to juggle both of those things. So hopefully those are successful. I am slightly wary of asking whether Zoom can hear, but I kind of need to know. We're going to move forward and start. So I'd like to open and welcome everybody to Queensland Children's Hospital. And I'd like to acknowledge the traditional owners and custodians of the land on which we meet. We pay our respects to ancestors and their descendants who continue cultural and spiritual connections to country. And we recognise their valuable contributions to Australian and global society. The Brisbane Transplant ID meeting, this is the third meeting in what I'm hoping, and I think we're all hoping, is going to be a series of increasingly global networks. The first meeting was started and held at Royal Brisbane, and last year at PATRI, and this year here. So we're really showcasing the collaborative multidisciplinary network that we're developing within pediatric ID. So pediatric ID are embracing the adult ID transplanters. And not just ID, but the fantastic collaboration with transplanters as a whole in order to think about the infectious diseases supportive care aspects of transplant ID. And that ethos is really increasing in value. So the program today looks like a really fantastic program. And the two things that we really wanted to emphasize were the breadth of expertise and collaboration going on, both locally and nationally, and the interest and enthusiasm that we have. So our jobs today are to try and keep to time, and we are not doing too badly considering. So as we move through the program, we are going to be as tight as we can with the timings so that we've got a little bit of time at the end of each talk to facilitate some discussion if we have time. If we don't have time for discussion, then we will stop and move on to the next talk because there's so much to get through and we do not want to disadvantage each individual speaker. I will now introduce the chair for session one. So session one chair is Dr. Becky Lowe. And Becky is a hematology CAR T-cell fellow at Royal Brisbane. She's dual training in clinical and laboratory hematology. She has an interest in the molecular drivers of hematologic malignancy, particularly myeloid disorders and leukemia, and bone marrow transplantation. Her current projects involved acute GVHD management and frailty assessment to guide transplantation in the elderly. Becky, please come and help us to get the session underway. Thank you.
So thank you to the organisers for the opportunity to chair this session.